Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people you do business with. And today we're joined by Dr. Fariba Dayhim. She is the founder of Better Me Bariatrics and Aesthetics. She has nearly 30 years of experience in the field, so all kinds of great knowledge that she can share with us today. So, Dr. Dayhim, first of all, thanks for joining us.
Oh, thank you. Thanks for having me.
You know, as we mentioned, as we were getting ready for this podcast, I feel like this pandemic has caused people to go kind of in two directions. Some people that have gained weight through the process and need solutions there, and some people have actually gotten fit and committed themselves to that. But no matter if there's a pandemic or not, weight challenges are constant battle that people deal with. So first of all, just kind of give people a little bit of background about yourself and your practice.
Sure. So I'm a board certified surgeon. By training, I'm a surgeon. And I believe it was in 2008 that I kind of branched out to bariatric surgery. I did a minimally invasive and bariatric fellowship then. And in 2009, I just focused on bariatric surgery because during the fellowship, I was amazed at what bariatric surgery was doing for the patients. So I kind of focused on bariatric surgery. And then as I was doing bariatric surgery, I noted that there is a population of patients that we are missing as bariatric surgeons. Like there are patients who come to us, and since we don't have other tools, sometimes people just kind of push them into bariatric surgery, but they are not the best candidates, or bariatric surgery is not the best solution for them. So as I was practicing at the same time, I did a mini fellowship and I did all the continuous medical education that's required. And by 2010, I got my board in obesity medicine, which is the non-surgical weight loss. And I believe I was the first surgeon, the first bariatric surgeon in the country who got the board of obesity medicine. Now there are more, but I think I was the first one. And then as a bariatric surgeon and medical bariatrician, I noted the role of nutrition and how we can actually, put people on medications or do surgery. But if we really don't have the good knowledge and in-depth knowledge of nutrition, we are missing on something for our patients. So I also did got certified in nutrition. So I'm board certified in nutrition, obesity medicine, and surgery, and I'm also fellowship trained in bariatric surgery. So I feel that it's a unique situation that when patients come to me, I'm not limited by what I can offer them. Like if you go to someone who knows just bariatric surgery, would tell you, okay, you can do bypass or a sleeve. Or if you go to someone who just does non-surgical weight loss, it tells you, oh, surgery is too dangerous. Don't do that. Let's do. It's because they feel and they believe in what they're saying, but that's their only tool. Now, fortunately, since I have all these tools, I'm not limited by that. I am unbiased. I give the patient what's best for their situation.
And that's the ultimate question, Dr. Dayhim, when people come to see you, is they may think they need bariatric surgery. That's their only solution, but maybe they don't. Some people maybe don't think they need it, but they do.
Absolutely.
So how do you ultimately answer that question of which direction they should go?
So it actually takes a very in-depth interview, and I do a lot of stuff. So one of the reasons I actually started this Better Me Bariatrics and Aesthetics and went my own way, doing my own private practice, was that I do have this notion of you got to get to know your patient, number one, as a person. Number two, you got to get to know their medical background, surgical background, and then come up with a solution. So my consults take anywhere between an hour to 2 hours, because I believe how you work, are you a night shifter, right? How's your home situation? What other people around you are eating? What's your medical background? How many abdominal surgeries you had in the past? All of that, how you sleep, they all play a role on solution I'm going to offer you. And then when I have all those information, I give the patient more than what most people can do. Like for, again, most bariatric programs, this is your BMI. Based on your BMI and the comorbidities you have, this is your solution. So Then I put all of this on a plate and I tell the patient, these are your solutions, or this is your only solution because the other ones are not good for you. And then between me and the patient and what all the information we have on the plate, we decide which way to go. Sometimes we actually start with one plan and then we, prepare for the other plan or evolve into other plan.
Yeah, and I can understand how it's a complex answer that has a lot of different factors into it for everybody, but at the core is BMI. And for those listening that maybe don't know what BMI is, how is that calculated?
Yeah, that's a very good question. So BMI, or body mass index, is a formula that we can come up with a number that doesn't only consider the weight, but also weight and height. And that's very important to understand. So, you and I may be the same weight, but if I am only 5'4" and you are like 6'4", we don't even look alike, right? So the obesity definition in general can kind of be determined by BMI. And that's the most major factor. So it plays a very significant role in the sense that if your BMI is 40 and above, bariatric surgery may be a solution for you. If your BMI is 35 to 40, but you have comorbidities, things that are caused by obesity, like diabetes, high cholesterol, hypertension, sleep apnea, then, still weight loss surgery can be a solution for you, even though your BMI is not 40 yet. So one of the important factors that I put on that plate of information is that just based on your BMI, is bariatric surgery even an option or not? But there are, as you said, many complex factors that play a role in our ultimate decision.
And you do have a calculator on your site too. So if people are curious, they can plug some data in there and their
Yes.
BMI will calculate for them right there, right?
Yes, absolutely.
So I think the stigma is a big thing that people have to get over too. And there's a lot of social stigmas that we're going through right now that people are trying to break down. Mental health, the stigma of going to see a mental health expert, getting rid of that negative stigma. I think there's just the thought of bariatric surgery in somebody's mind. It brings this negative connotation to it. So how much of a challenge is it for you to get people past that stigma of mentally it's okay, and physically it's one of the safer procedures you go through? How much do you battle those challenges?
Interestingly, I got to tell you, um, I I find people when they come and we talk about it, they can see that in the bariatric surgery or bariatric medicine, doesn't matter which way they're going, they're looking at it and they come to see me. There is no judgment. They see that and they feel safe. That's very important because how I treat, the diagnosis of obesity or morbid obesity, and I tell my patients to treat themselves like that, is that it's no different than diagnosis of diabetes or pre-diabetes. These are just stages of a disease. And I actually have a video, it's on my website too, under other videos, that says, is it my fault? I constantly try to educate people that it's not about fault. It's like asking someone, you had a heart attack, was it your fault? Yes, it is our responsibility to take ourselves, but it is complex things. They can't be fault, right? So um, as I said, people feel that there is no judgment. They feel that we are dealing with a diagnosis and we treat it like any other disease. So they feel safe. But I can tell you, patients themselves, they have a battle within their communities, sometimes inside their families, just telling that, as you said, they're seeing, say, psychologist or a psychiatrist, or, as people call it, they're seeing a shrink, or they're seeing a bariatric person, that's a battle that they overcome typically by the time they get there, and I really admire them for it. It's not easy.
So let's talk about the surgery itself for those that do end up going through it. How long of a process is it? How is the recovery? What sort of risks are there with it?
Okay, so 3 questions. How long the process is? The process mainly depends on 2 things: patient's medical condition, but equally under insurance. So insurances have time criteria as how long the patient has to be in the program, and that's completely out of our hand. So, for instance, some insurances want the patient to be in a medically supervised program for minimum 6 months. There are a couple of insurances in Michigan that want it to be a whole year. There are a couple of insurances also in Michigan that give the patient the option to only work before the surgery for preparation for 3 months if they see the surgeon every month instead of seeing their primary care provider or dietitian for that. So that length of time is out of our hands. We go by their insurance requirements. Another factor is how is about optimization. So like any other surgery, we want the patient to be safe for surgery. So I can't just, if someone comes with a blood pressure of 180 over something, we have to make it safe first. If they have a BMI that's really high, I first work with them. And that's the good thing about having the tool of non-surgical weight loss, help them get their BMI to that safe BMI, their weight to that safe weight that they can actually fit on the OR table safely and things like that when we talk about it with the patient. And they have to do the psychology evaluation. If patients have cardiac issues or pulmonary issues, we get optimization and clearance from those doctors. So the length of time is dictated by these two factors, but typically it's never less than 3 months because getting all those requirements and also insurance requirements takes about that time. The second thing, I believe you asked how long, no, that was the third question. So I answered the third question first. How long is the recovery? Recovery, in fact, for majority of patients is amazing. So we get the patient out of bed right after their surgery, as soon as they're awake, like a few hours after surgery, they're walking the hallways, and that's a requirement. Typically, I don't keep patients more than 1 night in the hospital, although if they need to stay 2 nights, we keep them. And most of my patients go home without any narcotics. Actually, I have a video of a patient who said, I can't believe that I went home on Tylenol. I even didn't take Tylenol. So I haven't prescribed narcotics, I believe, for a few years now. And then, I see the patients in the mall, sooner than I think I see them outside. So the recovery is amazing because they feel better. They already start losing weight. They come off their insulin immediately. Typically, most patients go home after diabetic and hypertension medications. And I forgot your second question. It had 3 parts in it.
So I guess, like, what is the recovery like? What sort of, are there side effects that are risks involved in it?
Yes,
Yeah.
there is. So in this world, this is my motto. There is nothing that's without risk. When you leave your home to get to work, you accept the risk of car accident, especially if you live around Detroit, right? So I tell you this, the risks of having major complications from bariatric surgery is much less of getting hit by a car around Detroit. That, I think that answers it. And if you compare it to other surgeries, it's one of the safest. Actually, studies came out that showed the risk of bariatric surgery in good hands is less than having, other major surgeries, just even less than a hysterectomy, which is such a common surgery. It's even less than appendectomy and taking your gallbladder out. So there is nothing that's without risk, and we always have a really in-depth discussion about the risk because I'm a firm believer that you come out of the house and you take the risks because you know the risk and benefits. So when it comes to your surgery, you should have the same insight. You should know the risks and benefits, but put everything together is safer than driving around Detroit and is safer than having any other major surgery based on the current studies.
Yeah, I mean, and it's also safer than continuing to live in that state too, right?
Absolutely. That's for sure. Yeah, that's a great. I mean, actually, patients come here to have the surgery because they can no longer live with the complications of, the heavy weight that's affecting every single organ in their body. Imagine from the lungs to their heart, to their liver, to their joints, everything.
And that's a good point about auto accidents too. I mean, sometimes driving around here, I think I'd rather go under the knife than behind the wheel with the way traffic is sometimes.
Yes,
But
unfortunately.
yeah, that's a good way to look at it. And then you also offer tummy tucks afterwards as well too, right? As part of a whole package.
Yes, I do that. And I do tummy tucks regularly as well. I've been doing tummy tucks since 94, 95.
Okay.
But since 2009 and 10, I have been doing tummy tucks, the more challenging tummy tucks, which is after weight loss surgery. I call them more challenging because as you lose weight, the skin hangs way low, and then it becomes more challenging. You have to go more further back. I believe in doing that because long ago, there is humidity under the folds, so it helps their well-being, and also the self-image is important. Like someone has done everything right, and even if the tummy is not hanging to the degree that insurance recognizes it as a medical issue, if it gets in their way, I have patients who tell me it flops when I jog. It kind of discourages me of doing exercise, right? Or, every time I go in front of the mirror, I still see myself as obese because this is still hanging, even though I have lost 200 pounds, right? So I believe that it generally contributes to the sense of well-being.
And then you also have folks that don't need the surgery. You analyze it and say, you know what, I think you can take care of yourself without having to go through this procedure. What have you seen be effective for those people to end up losing weight on their own without having to go through the procedure?
Oh, that's the non-surgical part of my practice. Actually, I would say close to 50% of patients may end up not having surgery. Some of them may be even patients that we came for surgery and I discouraged them. And some of them may be patients that we both agreed surgery could be an option on the plate. And, they managed to, continue with the non-surgical weight loss and be very successful with it. So similarly, as you mentioned before, a percentage of patients who come for surgery, we may discuss and decide non-surgical weight loss is better, and some patients come for non-surgical and we feel that you really, really need to think about surgery. You have been down this road before. But when patients come for non-surgical weight loss, we have several meal plans that they can actually see the name of them on the website as well. So we have Better Me keto diet, we have Better Me intermittent fasting, we have Better Me low calorie diets that are not keto, and we also have Better Me way of life, which is actually a balanced meal plan. We can lose weight with it, we can also manage it. Now, the reason that I call them Better Me so and so is that they are not your typical keto, they are not your typical intermittent fasting. Although I have 4 or 5 meal plans, I individualize every single meal plan based on patient's lifestyle and needs. Not everybody needs to do intermittent fasting. Not everybody needs to do keto diet. So depending on how much change is required and how it fits in patient's social environment, in their work schedule, right, in their family environment and everything, we create an individualized diet that fits typically in the 5 categories. And as far as non-surgical weight loss goes, success definition is different nationally and internationally. 5% weight loss is considered success for non-surgical weight loss. I tell my patients, I have big eyes because I'm a bariatric surgeon, so we typically start at 10%. And I don't, it's not that we stop there. So when we get to that first goal, they pick another goal realistically based on, their body composition analysis. I do a body composition analysis baseline for everyone, and then we do it at intervals, making sure they're not losing muscle, they're actually gaining muscle, hopefully, and losing fat, they're losing their swelling, their edema, things like that. So by monitoring that, we may keep going. I have had actually a patient of mine was my partner's relative when I worked in Maine, a close relative, and he lost more than 100 pounds. And he has maintained it. I know that because he kept in touch. I mean, uh, we knew each other, so he kept in touch, and he is still maintaining. So it's possible.
Well, I just think the big key with any successful diet is probably motivation. What is that one thing that's going to motivate you? So maybe being so close to having to have a surgery, and the motivation is to distance yourself as far away from that number as possible. And in some cases, maybe that's all the motivation people need sometimes.
I think Motivation is very important, and sticking to it is extreme, like adherence. We call it adherence, and motivation plays a great role in adherence. And setting your priorities and stuff. But a lot of my patients are really, really motivated. And it's not like they don't want to do it or they're not motivated enough. Sometimes when you have more than 100 pounds to lose, your body resists it. Like you can lose about 20 pounds, and then you go into a plateau. So again, surgical and non-surgical is not for everyone. It's a matter of, it's exactly individualized, number one. And number two, another big factor in having success is being realistic about what success means for what treatment. And another factor is if the treatment fits you. There are, I don't know, over 500 different diets, known diets. Why there are so many? Because each diet works for a certain group of people. And in the most occasions, people don't take the time to see what fits whom. And that's important too.
So we've covered a great outline of your bariatrics part of your practice. Also briefly talk about the aesthetic side and some things that you do there.
Sure. So aesthetic is a newer thing that I introduced, and I look at it, honestly, I call it aesthetic because everybody calls it aesthetic, but the part that I use is the part that I believe is part of anti-aging and making a better skin. So I offer 3 platforms of laser and intense light therapy, but they are geared in majority towards creating a better collagen. So like one of the platforms that I offer goes deep in the skin and it stimulates the collagen, and you get actually a better, firmer collagen after 3-4 treatments. So the skin is really kind of timed back, 5 years, 10 years, depending on how much firmness we get from the new collagen from it. It's not like injecting into something in your skin so you look younger. It's actually making your skin younger. Another platform that I have is a special IPL platform that's called Divial, and what it does, it gets rid of the blemishes, typically from aging and sun damage. Again, is kind of taking the clock back. We don't put anything that shows you younger. It actually makes your skin younger. And there is another platform that does both of them together at the same time, a little bit more invasive. The good thing about the first platform, the collagen tightening platform, is that we can do it for any skin color. And that's rare for laser therapy. For most laser and intense light therapies, you can't do it for darker color. And I'm from Middle Eastern origin, and a lot of IPL stuff or laser stuff can't be done on my skin because I can burn with it easily because of too much pigment. But that laser platform that I'm talking about, Clear Lift, can go all the way down to the deep collagen, is not absorbed by the pigment. I can do it even on African American skin, although they rarely need it because of good collagen that they come with. But anybody, Middle Eastern people, South American people, you don't have to be really fair skin to benefit from it.
And we have a very diverse population in Metro Detroit, so that's very important.
Good point, yes.
So, Dr. Dayhim, obviously, so many great procedures you do. Hopefully, somebody listening to this reaches out to you to see, what the best fit is for them. What is the easiest way for people to reach out to you and get you have a wealth of information on your website, how to find that as well?
Oh, yes, good point. So my website is easy. It's my name, basically, drdayhim.com, drdayhim.com. They can reach out and ask for an appointment through the contact page on the website, or they can send an email to my staff at frontdesk@drdayhim.com, or they can just simply call us at 248-763-3554.
Very good. Well, again, thanks for your time and your service, and best of luck to you going forward.
Thank you. Same here.